Sarah Mitchell walked through the sterile corridors of St. Mary's General Hospital, her soft-soled shoes making barely a whisper against the polished floor. At 28, she had been working as a trauma nurse for 6 years, but, to most people who saw her petite frame and gentle demeanor, she looked like she belonged in pediatrics rather than the chaos of emergency medicine. Her auburn hair was always pulled back in a simple ponytail, and her scrubs were the standard hospital blue that made her blend into the background of the busy medical center. The emergency room was unusually quiet for a Tuesday evening. Sarah was restocking supplies in Trauma Bay 3 when she overheard Dr. Marcus Weber talking to a group of medical students near the nurses' station. Dr. Weber was the kind of surgeon who believed his medical degree gave him the right to look down on everyone else in the hospital. He was tall, perfectly groomed, and never missed an opportunity to remind people that he had graduated from Harvard Medical School. "Remember, Dr. Weber was saying to the students, his voice carrying that familiar tone of superiority, in trauma situations, you need to trust the expertise of trained surgeons. Don't let yourself be distracted by the opinions of support staff, no matter how well-meaning they might be." His eyes swept across the room and landed on Sarah. "Nurses like Miss Mitchell over there are certainly dedicated, but they simply don't have the training to make critical medical decisions. They're here to follow orders and provide basic care." Sarah felt her cheeks flush, but she continued organizing the medical supplies without looking up. She had heard similar comments from Dr. Weber before, though never quite so publicly. The medical students nodded respectfully, hanging on every word from the renowned surgeon who had built his reputation on complex cardiac procedures. "I've been practicing medicine for 15 years, Dr. Weber continued, adjusting his pristine white coat. "I've seen nurses who think they know better than doctors, and it never ends well. The hierarchy exists for a reason. Medical school, residency, fellowship, these things matter. You can't learn surgical judgment from a 2-year nursing program." One of the medical students, a young woman with kind eyes, glanced over at Sarah with an apologetic expression. Sarah managed a small smile in return, silently appreciating the gesture. She had learned long ago not to let Dr. Weber's comments affect her work. There were patients to care for, and that was all that mattered. The automatic doors to the emergency department burst open with a harsh mechanical sound. 2 paramedics rushed in pushing a gurney, their faces grim with the intensity that came with a serious trauma case. Behind them, a woman in civilian clothes was speaking rapidly into a secure radio, her voice crisp and authoritative despite the obvious stress of the situation. "Multiple GSWs, significant blood loss," the lead paramedic called out as they wheeled the patient toward the trauma bay. "Patient is a 24-year-old male, military ID indicates special operations. We've got 2 entry wounds to the abdomen and 1 to the upper chest. Lost consciousness twice during transport but responded to verbal stimuli." Sarah immediately moved toward the trauma bay, her training taking over as she prepared to assist with what was clearly going to be a complex case. The patient on the gurney was young and powerfully built, with the kind of muscle definition that spoke of years of intense physical conditioning. Even unconscious and pale from blood loss, there was something about his bearing that suggested he was accustomed to facing dangerous situations. Dr. Weber appeared at Sarah's shoulder, having abandoned his impromptu lecture to the medical students. "This is exactly the kind of case that requires surgical expertise," he said, more to himself than to anyone else. "We'll need to get him into or immediately." As the paramedics transferred the patient to the hospital gurney, Sarah began her initial assessment. She checked his pulse, which was rapid but stronger than she had expected given the amount of blood he had lost. His breathing was labored but regular. Most importantly, his color was improving now that they had him on supplemental oxygen and for fluids. The woman who had come in with the paramedics approached the foot of the bed. She was in her 40s, with short gray hair and the kind of bearing that suggested military background. Her civilian clothes were expensive but practical, and she wore them with the confidence of someone accustomed to being in charge. "How is he?" she asked, her eyes focused intently on the patient. "We're doing everything we can," Dr. Weber replied, stepping forward to take charge of the conversation. "I'm Dr. Weber, the attending surgeon." "Are you family?" "I'm Commander Patricia Hayes," the woman replied. "I can't discuss the exact nature of his mission, but I can tell you that this young man is one of our most valuable assets. Whatever resources you need, whatever specialists you want to bring in, just say the word." Sarah was checking the patient's bandages when she noticed something unusual. The field dressings had been applied with a level of precision that went beyond standard first aid training. Someone with advanced medical knowledge had worked on this patient before the paramedics arrived. The pressure points were perfect, the bandaging technique was textbook, and, most importantly, whoever had treated him had managed to slow the bleeding enough to keep him stable during transport. "Doctor," Sarah said quietly, "I think someone with medical training worked on him at the scene. These dressings are very well done." Dr. Weber barely glanced at what she was indicating. "Probably one of the paramedics adjusted them during transport," he said dismissively. "Let's focus on getting him prepped for surgery." Sarah wanted to point out that the paramedics had specifically mentioned they hadn't had time to do anything beyond basic stabilization during the transport, but she knew Dr. Weber wasn't really listening to her. Instead, she continued her assessment, noting that despite the severity of his injuries, the patient's vital signs were remarkably stable. Commander Hayes stepped closer to the bed. "His name is David Chen," she said softly. "He's been with our unit for 3 years. Best combat medic we've ever had, and one of the finest soldiers I've ever had the privilege to command." "Combat medic?" Sarah asked, looking up from adjusting the patient's foreline. "Among other things," Commander Hayes replied. "Before he joined Special Operations, he completed medical training that would qualify him to work as a trauma surgeon in most civilian hospitals. He saved more lives in combat zones than most doctors save in their entire careers." Dr. Weber was studying the patient's chart and X-rays on the portable machine. "Regardless of his background, he needs immediate surgical intervention. We have significant internal bleeding that needs to be controlled, and there's possible damage to major organs." Sarah agreed that surgery was necessary, but something about the patient's condition made her think there might be more time than Dr. Weber was suggesting. His blood pressure was low but not critically so, and his heart rate was elevated but not indicating immediate distress. Most importantly, his breathing was becoming stronger and more regular as the supplemental oxygen and fluids took effect. "Doctor," she said carefully, "his vitals are actually improving. Maybe we should do a more thorough assessment before rushing into surgery." Dr. Weber turned to face her with an expression of barely contained irritation. "Miss Mitchell, I understand that you want to help, but this is exactly what I was just explaining to the medical students. Trauma surgery requires years of specialized training. This patient has multiple gunshot wounds and significant internal bleeding. Every minute we delay increases the risk of complications or death." "I'm not suggesting we delay treatment," Sarah replied, keeping her voice calm and professional. "I'm just noting that his condition seems more stable than it initially appeared. Sometimes taking a few extra minutes for proper assessment can prevent unnecessary surgical complications." The patient on the gurney stirred slightly, his eyelids fluttering as consciousness began to return. Sarah immediately moved to his side, placing a gentle hand on his shoulder to keep him calm. "Sir, you're in the hospital," she said softly. "You've been injured, but you're safe now. Try to stay still and let us take care of you." David's eyes opened slowly, and Sarah could see the immediate awareness that marked him as someone with extensive training in high-stress situations. Despite his injuries and the medication he had received, his eyes were alert and focused. "How bad?" he asked, his voice barely above a whisper. "You have 3 gunshot wounds," Sarah replied honestly. "We're going to take good care of you." David's eyes moved to take in his surroundings, quickly assessing the medical equipment, the 4 lines, and the people around his bed. His gaze paused on Sarah, and she saw a flicker of something that might have been recognition, though she was certain they had never met. Dr. Weber stepped into David's line of sight. "I'm Dr. Weber, and I'll be performing your surgery. We need to get you into the operating room immediately to repair the damage from your wounds." David's eyes moved back to Sarah. "What's your assessment?" he asked quietly. Sarah was surprised by the question, but she answered honestly. "Your vital signs are stabilizing. Blood pressure is low but improving with fluids. Heart rate elevated but not critically. Respiratory function is good. The bleeding has been controlled with the field dressings. Sarah, Dr. Weber said sharply, this patient doesn't need your assessment. He needs surgical intervention. But David was still looking at Sarah with those alert, intelligent eyes. Field dressings, he asked. Yes, Sarah replied. Someone with advanced medical training worked on you before the paramedics arrived. The technique was excellent. A small smile crossed David's pale lips. That was my team leader. Former Army surgeon before he went special ops. Commander Hayes stepped closer to the bed. David, how are you feeling? Like I've been shot 3 times, David replied, managing a weak grin. But, better than I expected, thanks to Rodriguez's fieldwork. Dr. Weber was growing increasingly impatient with the conversation. We really need to get moving on this. Every minute we wait increases the risk of complications. Sarah checked David's latest vital sign readings on the monitor. His blood pressure had continued to improve, and his heart rate was coming down as his body responded to the treatment. Doctor, his numbers are really looking better. Maybe we could do a CT scan first to get a better picture of the internal damage before deciding on the surgical approach. Miss Mitchell, Dr. Weber said, his voice taking on a tone of barely controlled anger, I have been practicing trauma surgery for 15 years. I know when a patient needs immediate surgical intervention, and this patient needs it now. I don't need input from a nurse about surgical timing. The room fell silent for a moment. Sarah felt the eyes of everyone present, the medical students, Commander Hayes, the other nurses who had gathered to help, focused on her. She knew that Dr. Weber was asserting his authority not just over this case, but over her position in the hospital hierarchy. David's voice cut through the tension, quiet but clear. Doctor, with all due respect, I'd like to hear what the nurse has to say. Dr. Weber's face flushed with anger. This is exactly the kind of situation I was just warning the medical students about. Nurses who think they know better than trained surgeons. Miss Mitchell is dedicated, I'm sure, but she simply doesn't have the training to make these kinds of medical decisions. Sarah felt her cheeks burn with embarrassment, but she also felt a spark of anger at Dr. Weber's public dismissal of her expertise. She had been working in trauma medicine for 6 years. She had seen hundreds of cases like this. And her instincts were telling her that while David definitely needed surgery, the immediate rush that Dr. Weber was insisting on might not be necessary. Commander Hayes was watching the exchange with interest, her experienced eyes moving between Dr. Weber and Sarah as if she was assessing the competence of both medical professionals. David tried to sit up slightly, wincing with pain but managing to focus his attention on Dr. Weber. Doctor, he said, his voice growing stronger, I appreciate your expertise, and I understand that you want to provide the best possible care. But I've worked alongside some of the finest military surgeons in the world, and I've learned that the best medical decisions are made when all voices are heard. This is a civilian hospital, Dr. Weber replied stiffly, not a military unit. We have protocols and hierarchies for a reason. Sarah watched the exchange with a growing sense that there was more to this situation than Dr. Weber understood. Commander Hayes had mentioned that David was one of their most valuable assets, and his calm competence even while seriously injured suggested someone with extensive training and experience. But, Dr. Weber seemed determined to view him simply as another trauma patient who needed to be processed through the system as quickly as possible. The tension in the room was broken by the arrival of Dr. Jennifer Martinez, the emergency department chief. Dr. Martinez was a woman in her 50s who had built her reputation on both medical excellence and administrative skill. She had worked her way up through the hospital hierarchy over 20 years and commanded the respect of everyone in the department. What's the status? Dr. Martinez asked, quickly reviewing David's chart and vital signs. Multiple GSWs, needs immediate surgical intervention, Dr. Weber replied. I was just explaining to the nursing staff that we don't have time for extended assessments. Dr. Martinez studied the monitor readings and then looked at David, who met her gaze with alert eyes. How are you feeling? Better than I did an hour ago, David replied honestly. The field treatment was excellent, and the care here has been top-notch. I think the immediate crisis has passed. Sarah, Dr. Martinez said, turning to the nurse, What's your assessment? Sarah felt Dr. Weber's disapproving stare as she answered. Vitals are improving steadily. Blood loss was significant but controlled. Patient is alert and responsive. I think there's time for proper imaging and surgical planning. Dr. Martinez nodded thoughtfully. Let's get a CT scan and see exactly what we're dealing with. Marcus, I know you want to move quickly, but 30 minutes for proper assessment could save hours in the OR if we know exactly what we're repairing. Dr. Weber looked like he wanted to argue, but Dr. Martinez's authority in the emergency department was absolute. Fine, he said curtly. But I want it noted that I recommended immediate surgical intervention. As the team prepared to move David to radiology, Sarah found herself walking alongside his gurney. She was checking his 4 lines when he looked up at her with those sharp, intelligent eyes. Thank you, he said quietly. Just doing my job, Sarah replied. David smiled slightly. No, you were doing more than that. You were thinking like a medic, not just following protocols. Sarah wasn't sure how to respond to that comment, but something in David's tone suggested it was a significant compliment. As they reached the radiology department, she realized that this case was going to be more complex than Dr. Weber understood. And, somehow, she suspected that her own role in David's care was just beginning. The CT scan results appeared on the computer screen 45 minutes later, and Sarah watched as Dr. Martinez studied the images with careful attention. Dr. Weber stood beside her, his impatience evident in the way he tapped his fingers against the counter. The radiology department was quiet except for the hum of machinery and the soft clicking of Dr. Martinez's mouse as she scrolled through the detailed images of David's internal injuries. Sarah had stayed with David during the scan, partly because her shift wasn't over and partly because she felt a professional responsibility to see his case through. There was something about his calm competence that reminded her of why she had gone into trauma nursing in the first place. Even seriously injured, he maintained the kind of awareness and composure that spoke of extensive training in high-stress situations. Interesting, Dr. Martinez murmured, leaning closer to the screen. What do you see? Dr. Weber asked, moving to get a better view of the images. The good news is that there's less internal damage than we initially feared, Dr. Martinez replied. The chest wound missed the major organs entirely. It looks like the bullet passed between the ribs and exited without hitting lung tissue or major blood vessels. Sarah felt a sense of relief wash over her. Her instinct that David's condition was more stable than it initially appeared had been correct. The improvement in his vital signs made more sense now that they could see the actual extent of his injuries. And the abdominal wounds? Dr. Weber asked. Dr. Martinez pointed to specific areas on the screen. One bullet passed through muscle tissue without hitting any organs. The other nicked the edge of the liver, but it's a clean wound that's already stopped bleeding on its own. So surgery is still necessary? Dr. Weber pressed. Minor surgical repair, yes, Dr. Martinez replied. But nothing that requires the immediate emergency intervention we were originally planning. The field treatment he received was genuinely excellent. Whoever worked on him knew exactly what they were doing. Sarah thought about Commander Hayes' comment that David's team leader was a former Army surgeon. Military medical training was apparently even more comprehensive than she had realized. The fact that someone with that level of expertise had been able to treat David at the scene explained why his condition had been more stable than the severity of his injuries would normally suggest. Dr. Weber studied the images for several minutes, his expression gradually shifting from urgency to something that looked like disappointment. Sarah realized that he had been expecting a complex surgical case that would showcase his skills, and the reality of David's relatively minor injuries was probably frustrating for someone of his ego. Well, Dr. Weber said finally, I suppose we can schedule him for surgery in the morning. The repairs needed are fairly straightforward. Actually, Dr. Martinez said, I'm thinking this might be a good case for Dr. Harrison to handle. The liver repair is exactly the kind of procedure she needs for her trauma surgery certification. Dr. Weber's expression darkened. Dr. Emily Harrison was a surgical resident in her final year, and Dr. Weber had made no secret of his opinion that she wasn't ready for independent surgical procedures. The fact that Dr. Martinez was suggesting she handle this case was clearly a blow to his professional pride. "I think a case like this requires an experienced surgeon," Dr. Weber said stiffly. "Marcus, it's a simple liver repair and some muscle tissue suturing," Dr. Martinez replied. "Dr. Harrison has performed similar procedures under supervision multiple times. Besides, our patient is military special operations. I suspect he'd appreciate having a surgeon who isn't intimidated by challenging cases." Sarah watched this exchange with interest. Hospital politics were always complex, but she was beginning to see that David's case was becoming a focal point for several different tensions within the medical staff. Dr. Weber's need to assert his authority, Dr. Martinez's efforts to provide training opportunities for residents, and the unusual nature of their patient's background were all creating a complicated dynamic. They returned to the trauma bay where David was waiting for the results. Commander Hayes was still present, speaking quietly into her secure radio while keeping one eye on her injured team member. Sarah noticed that several other people had arrived while they were in radiology, 2 men in civilian clothes who had the same bearing as Commander Hayes, and a woman in military uniform who appeared to be taking notes on everything happening around David's treatment. "Good news," Dr. Martinez announced as she approached David's bed. "The damage is much less severe than we initially thought. You'll need some minor surgical repair, but nothing major." David nodded, unsurprised by the news. "The field assessment was pretty thorough," he said. "Rodriguez thought it looked worse than it was because of the blood loss." "Your team leader has excellent medical judgment," Dr. Martinez replied. "The field treatment probably saved us hours in surgery." Dr. Weber stepped forward. "We'll schedule the surgery for first thing tomorrow morning. It should be fairly routine." "Actually," Dr. Martinez said, "I'm assigning Dr. Harrison as the primary surgeon. She's an excellent resident who needs experience with this type of case." Sarah saw something flicker in David's eyes, not concern, exactly, but the kind of heightened alertness that came with processing new information. She realized that as a combat medic, he probably had strong opinions about the competence of the medical professionals treating him. "Dr. Harrison is supervised by Dr. Weber, of course," Dr. Martinez added quickly, apparently noticing David's reaction. "I'd actually like to meet Dr. Harrison before the surgery," David said calmly. "If that's possible." Dr. Weber looked irritated by the request. "That's not really necessary. Dr. Harrison is perfectly qualified to perform the procedure." "I'm sure she is," David replied. "But, in my line of work, we don't go into any situation without knowing who we're working with." Commander Hayes stepped closer to the bed. "David's request is reasonable. In military medicine, the relationship between patient and surgeon is considered crucial for optimal outcomes." Sarah found herself admiring David's diplomatic approach. He wasn't questioning Dr. Harrison's competence, but he was asserting his right as a patient to be involved in decisions about his own care. It was the kind of measured, professional response that she was learning to expect from him. Dr. Martinez nodded approvingly. "Of course. I'll have Dr. Harrison come down to meet you this evening." As the doctors moved away to discuss scheduling and procedure details, Sarah remained at David's bedside to check his vital signs and ensure his comfort. His color had improved dramatically since his arrival, and his breathing was strong and regular. The 4 fluids and pain medication were clearly doing their job. "You were right about taking time for proper assessment," David said quietly, his voice meant only for Sarah's ears. "Just following standard protocol," Sarah replied, adjusting his pillow to help him sit more comfortably. "No," David said, "you were doing more than that. You were reading the situation and trusting your clinical judgment even when someone with more authority was pushing for a different approach." Sarah wasn't sure how to respond. In her 6 years as a trauma nurse, she had developed strong instincts about patient care, but she rarely had the opportunity to voice opinions that contradicted attending physicians. Dr. Weber's public dismissal of her input had been embarrassing, but she was glad that events had proven her assessment correct. "Can I ask you something?" David said, his voice still quiet. "Of course. Have you ever thought about advancing your medical training?" Sarah paused in adjusting his foreline. "What do you mean?"
physician assistant, nurse practitioner, maybe even medical school. You have the clinical instincts for it. The comment caught Sarah off guard.
She had occasionally thought about furthering her education, but the demands of her job and the financial challenges of additional schooling had always made it seem impractical. More than that, she had never been sure she had the confidence to take on greater medical responsibilities.
I've thought about it, she admitted. But it's complicated.
It usually is, David replied. But talent like yours shouldn't be wasted in a system that doesn't recognize it. Before Sarah could respond, Dr.
Emily Harrison appeared at the foot of the bed.
Dr. Harrison was in her early 30s, with the focused intensity that marked the best surgical residents. She was small in stature like Sarah, but she carried herself with the quiet confidence of someone who had proven herself repeatedly in challenging situations.
Mr. Chen?
Dr. Harrison said, extending her hand.
I'm Dr. Harrison. I'll be performing your surgery tomorrow morning.
David shook her hand with a firm grip.
Please, call me David. I understand you're a resident?
Final year, Dr. Harrison replied without defensiveness.
This type of liver repair is a procedure I've performed multiple times under supervision. My attending will be present throughout the surgery. Sarah watched David assess Dr. Harrison with the same careful attention he had given to everything else since his arrival.
She could almost see him evaluating the surgeon's competence based on her demeanor, her confidence, and the way she presented information about the procedure.
What's your assessment of the surgical approach needed? David asked.
Dr. Harrison moved to the computer terminal and pulled up his CT scan images. Single entry wound to the liver, clean edges, minimal tissue damage. We'll need to repair the tear and ensure there's no ongoing bleeding. The muscle tissue damage in your abdomen will require suturing, but nothing complex.
I estimate about 90 minutes in the OR. David nodded approvingly.
That matches my own assessment based on the field examination and the pain levels I'm experiencing.
Dr. Harrison looked surprised. You examined yourself? Combat medic training, David explained. I've done field surgery under fire.
Nothing as sophisticated as what you'll be doing tomorrow, but enough to have a good sense of what needs to be repaired. In that case, Dr. Harrison said with a slight smile, you'll probably be a better patient than most. You'll understand the recovery process and follow post-operative instructions. Sarah found herself impressed with Dr. Harrison's confidence and professionalism.
Unlike Dr. Weber, she didn't seem threatened by David's medical knowledge. Instead, she appeared to view it as an asset that would help with his treatment. I have one request, David said. I'd like Sarah to be assigned to my post-operative care. Dr. Harrison glanced at Sarah with interest. Any particular reason? She demonstrated excellent clinical judgment during my initial assessment, David replied.
I'd feel more comfortable having someone with her level of competence involved in my recovery. Sarah felt her cheeks flush with the unexpected compliment. It was unusual for patients to request specific nurses, and even more unusual for those requests to be based on clinical competence rather than personal preference. I'll make sure that's noted in your chart, Dr. Harrison said.
Sarah's reputation in the trauma unit is excellent. You'll be in good hands.
As Dr. Harrison left to prepare for the surgery, Sarah realized that David's comment about her clinical judgment was the second time in one evening that someone had recognized her medical abilities. First, Dr. Martinez had asked for her assessment in front of Dr. Weber, and now a patient with extensive medical training was specifically requesting her involvement in his care. Commander Hayes approached the bed as Sarah was checking David's latest vital sign readings. "How are you feeling about the surgical plan?" she asked.
"Confident," David replied. Dr.
Harrison knows what she's doing, and the procedure is straightforward. More importantly, the field treatment bought us time to do proper assessment and planning.
Commander Hayes nodded and then looked at Sarah.
I understand you advocated for taking time to properly evaluate David's condition instead of rushing into emergency surgery. Sarah felt uncomfortable being the center of attention, but she answered honestly. His vital signs were telling a different story than the initial trauma presentation suggested.
I thought additional assessment was warranted.
That kind of clinical judgment has saved lives in combat situations, Commander Hayes said. Military medics learn to read subtle signs that others might miss.
The comment made Sarah think about David's earlier suggestion that she consider advancing her medical education.
She had always assumed that her instincts about patient care were simply the result of experience, but perhaps there was more potential there than she had realized. The evening shift change brought new nurses into the trauma unit, but Sarah had arranged to stay late to continue monitoring David's condition. His vital signs remained stable, and he was alert and comfortable despite the pain medication. More importantly, he seemed genuinely interested in talking with her about medical topics in a way that treated her as a knowledgeable colleague rather than simply someone following orders.
"Can I ask you about something?"
Sarah said as she was updating his chart.
"Of course. Earlier, when you asked Dr. Weber to hear what I had to say about your condition, that was unusual.
Most patients defer completely to the attending physician."
David was quiet for a moment, as if considering how to answer.
"In special operations, we work with people from all kinds of backgrounds, different military branches, intelligence agencies, civilian contractors. The best teams are the ones where good ideas are recognized regardless of who they come from."
"But there are still hierarchies, right?"
"Absolutely.
But effective leaders know that rank doesn't always correlate with competence or insight."
"The best commanding officers I've worked with listen to input from everyone on the team." Sarah found herself thinking about the contrast between David's approach and Dr.
Weber's rigid adherence to hospital hierarchy.
In the military, where mistakes could cost lives, there seemed to be more willingness to value competence over credentials. "The thing is," David continued, "I could tell from the way you were assessing my condition that you had serious medical training. Your hands-on examination was thorough and professional.
Your observations about my vital signs were accurate.
And, most importantly, you were willing to speak up when you thought the treatment plan might be wrong."
Dr. Weber wasn't happy about that.
"Dr. Weber strikes me as someone who's more concerned with maintaining authority than with providing optimal patient care," David said bluntly.
"That's a dangerous attitude in any medical setting."
Sarah was surprised by his directness, but she realized that as a patient with extensive medical background, David was probably used to evaluating the competence of the healthcare providers treating him.
"Have you worked with civilian medical teams before?" she asked.
"Several times, usually in disaster relief situations where military and civilian medical personnel work together.
The best outcomes happen when everyone focuses on patient care rather than professional turf wars."
Sarah thought about the tension she had witnessed between Dr. Weber and Dr. Martinez, and the way Dr. Weber had dismissed her input in front of the medical students. She wondered if hospital politics were getting in the way of optimal patient care more often than she realized.
"What made you go into special operations?" she asked. "If you don't mind me asking." David smiled slightly.
"I wanted to use my medical training to help people in situations where it could make the biggest difference. Combat medicine is challenging, but there's something satisfying about being able to save lives under the most difficult circumstances."
"Is that why you became a medic first, before the other training?"
"Actually, it was the opposite," David said. "I was recruited for special operations because of my medical background. The military needs operators who can provide advanced medical care in remote locations where traditional medical support isn't available."
Sarah realized that David's background was probably even more complex than Commander Hayes had indicated.
Special operations medics weren't just soldiers with first aid training, they were highly skilled medical professionals who could perform complex procedures under combat conditions.
"The surgery tomorrow," she said, "you're really not worried about it?"
"Not at all," David replied. "Dr. Harrison is competent, the procedure is straightforward, and, most importantly, the initial assessment and treatment were excellent. When you get good care from the start, everything else tends to go smoothly." Sarah felt a warm sense of satisfaction at his confidence in the care he had received. Despite Dr. Weber's dismissive comments, her clinical judgment had been vindicated, and a patient with sophisticated medical knowledge had specifically requested her continued involvement in his care. As the evening wore on, Sarah found herself engaged in the kind of professional medical discussion that she rarely had the opportunity to participate in. David's questions about hospital procedures and protocols were insightful, and his comments about military medicine gave her a new perspective on emergency healthcare. "You know," David said as Sarah was preparing to end her shift, "if you ever want to use your medical skills in a different setting, the military is always looking for experienced trauma nurses. The training opportunities are excellent, and you'd be working with some of the finest medical professionals in the world." Sarah had never considered military service, but David's comment made her think about the possibilities that might exist beyond the rigid hierarchy of civilian hospital medicine. She realized that for the first time in years, she was feeling genuinely excited about her career potential. "I'll think about it," she said, and meant it. As Sarah gathered her things to leave for the night, she reflected on how much her perspective had changed in just one evening. A routine trauma case had turned into an encounter with a patient whose background and insights were challenging her assumptions about medicine, hierarchy, and her own professional potential. Tomorrow's surgery would be routine, but Sarah had the feeling that David Chen's impact on her career was just beginning. Sarah arrived at the hospital the next morning 30 minutes before her shift was scheduled to begin. She had spent most of the previous evening thinking about her conversation with David Chen, and she found herself genuinely curious about how his surgery would go. She had also been unable to stop thinking about his suggestion that she consider advancing her medical education or exploring opportunities in military medicine. The preoperative area was busy with the usual morning surgical schedule. Sarah checked the board and saw that David's surgery was scheduled for 10 o'clock with Dr. Harrison as the primary surgeon and Dr. Weber supervising. She made her way to his room to check on his condition and provide preoperative care. David was awake and alert, reading what appeared to be a medical journal on a tablet computer. He looked up as Sarah entered the room, and she was pleased to see that his color was excellent and he appeared to be in minimal discomfort. "How are you feeling this morning?" she asked, beginning her standard preoperative assessment. "Much better than yesterday," David replied honestly. "The pain is manageable, and I slept well. More importantly, all my systems feel like they're functioning normally." Sarah checked his vital signs and was pleased to find that everything was within normal ranges. His blood pressure had completely stabilized, his heart rate was normal, and his temperature showed no signs of infection. The foresight looked good, and his surgical incision sites showed no signs of inflammation or complications. Dr. Harrison stopped by earlier to review the surgical plan, David said as Sarah updated his chart. "I'm impressed with her preparation and attention to detail." "She's one of our best residents," Sarah replied. "Very thorough and technically skilled. She also seems confident enough to listen to input from others," David added. "That's not always the case with surgeons." Sarah understood the implicit comparison to Dr. Weber, though she didn't comment on it directly. Instead, she focused on preparing David for the surgery, explaining the timeline and what he could expect during the recovery process. "I have a question for you," David said as Sarah was completing her preoperative checklist. "What's that?" "Yesterday you mentioned that advancing your medical education was complicated. Can I ask what kind of complications?" Sarah paused in her work. It wasn't the kind of personal question that patients usually asked, but her conversation with David the previous evening had been unusually candid and professional. She found herself comfortable discussing career challenges with someone who seemed genuinely interested in her professional development. "Financial mainly," she replied honestly. "Nurse practitioner programs are expensive, and I'd have to cut back on work hours to attend classes. I support my younger sister through college, so taking on debt and reducing income at the same time isn't really practical." David nodded thoughtfully. "What about your sister? What's she studying?" "Pre-med at the State University. She wants to become a pediatric surgeon." "She's brilliant, but medical school is going to be another financial challenge." "So you're supporting someone else's medical education while putting your own on hold." The way David summarized the situation made Sarah realize how much she had been sacrificing her own career advancement to help her sister pursue hers. She had never really thought about it in those terms, but the pattern was clear when someone else stated it plainly. "She's always been the smart one in the family," Sarah said with a slight smile, I'm just happy to help her achieve her goals. From what I've observed of your clinical skills and judgment, I'd say intelligence runs in your family, David replied. The question is whether you're going to let financial obstacles prevent you from reaching your own potential. Before Sarah could respond, Dr. Harrison appeared in the doorway with a surgical team member to begin the process of transporting David to the operating room. Sarah was grateful for the interruption, as David's comments were forcing her to confront questions about her career that she had been avoiding for months. The surgery was scheduled to last approximately 90 minutes, so Sarah used the time to catch up on other patient care responsibilities and administrative tasks. She found herself checking the surgical schedule board more frequently than usual, watching for updates on David's procedure. Dr. Martinez found her at the nurse's station around 11:30. David Chen's surgery is going well, she said. Dr. Harrison is doing excellent work, and the repairs are more straightforward than we anticipated. That's good to hear, Sarah replied. His preoperative condition was excellent. Sarah, can I ask you something? Dr. Martinez said, lowering her voice. Yesterday, when you suggested taking additional time for assessment instead of rushing into emergency surgery, was that based on specific clinical observations, or was it more of a general feeling? Sarah thought carefully about how to answer. Specific observations. His vital signs were improving consistently, his respiratory function was strong, and his level of consciousness was better than I would have expected from someone with significant internal bleeding. It seemed like the immediate crisis had passed. Dr. Martinez nodded approvingly. That's exactly the kind of clinical judgment we need more of in emergency medicine. Too often, the pressure to act quickly overrides careful assessment. Dr. Weber seemed to think I was overstepping my role as a nurse. Dr. Weber has strong opinions about hospital hierarchy, Dr. Martinez replied diplomatically. But, good patient care depends on input from all team members, regardless of their position in the organizational chart. Sarah appreciated Dr. Martinez's support, but she also sensed that there might be ongoing tension between her approach to emergency medicine and Dr. Weber's more authoritarian style. She wondered how that tension might affect her future assignments in the trauma unit. Around noon, Dr. Harrison emerged from the operating room and approached the nurse's station where Sarah was working. The surgeon looked pleased with the outcome of the procedure. The surgery went perfectly, Dr. Harrison announced. The liver repair was clean and straightforward, and the muscle tissue damage was minimal. Mr. Chen should have a completely normal recovery. How was he as a patient during the procedure? Sarah asked. Dr. Harrison smiled. Even under anesthesia, he was remarkably stable. His cardiovascular system responded exactly as textbook would predict, and there were no complications at any stage. Whoever provided his initial trauma care really knew what they were doing. His team leader is apparently a former Army surgeon, Sarah explained. That makes sense. The field dressings and treatment decisions probably saved his life. In a combat situation, that level of medical expertise could make the difference between survival and bleeding out. Sarah realized that David's case was providing educational value for the entire medical team. The contrast between excellent field treatment and the hospital's initial rush to emergency surgery had highlighted the importance of thorough assessment and careful planning. He specifically requested that you be assigned to his post-operative care, Dr. Harrison continued. I've made sure that's noted in all the relevant charts. Sarah felt a mix of professional pride and personal pressure. Having a patient with extensive medical training specifically request her care was both flattering and challenging. She would need to provide the highest standard of nursing care while also being prepared for the kind of informed questions and observations that David would bring to his recovery process. David was transported to the post-surgical recovery unit around 1 o'clock, and Sarah was there to receive him as he emerged from anesthesia. His vital signs were excellent, and he was alert and oriented within minutes of arriving in recovery. How do you feel? Sarah asked as she checked his surgical dressings and 4 lines. Like I'd been cut open and sewn back together, David replied with a weak smile, but better than I felt yesterday before the surgery. Sarah was pleased to see that his sense of humor was intact and that he was managing the post-operative pain well. His surgical sites looked clean and properly bandaged, and there were no signs of complications from the procedure. Dr. Harrison said the surgery went perfectly, Sarah reported. Clean repair, no complications, normal recovery expected.
David nodded. I could tell from the anesthesia recovery that everything had gone smoothly.
When surgery goes well, you wake up feeling like your body is healing rather than fighting additional trauma.
Once again, Sarah was impressed by David's medical sophistication.
Most patients had very little understanding of how surgical outcomes affected their recovery experience, but David's background allowed him to assess his own condition with remarkable accuracy. Commander Hayes arrived at the recovery unit around 2 o'clock, accompanied by the same woman in military uniform who had been present the previous evening. Sarah noticed that both women seemed relieved to see David alert and comfortable.
How are you feeling, soldier?
Commander Hayes asked with obvious affection.
Much better, ma'am.
The surgical team here is excellent, and the nursing care has been outstanding. Commander Hayes looked at Sarah with interest.
You're the nurse who advocated for proper assessment before rushing into surgery?
Yes, ma'am, Sarah replied, feeling slightly uncomfortable with the attention. David mentioned that you have exceptional clinical judgment and suggested that you might be interested in opportunities to use your skills in a military setting. Sarah felt her heart rate increase slightly. She had not expected David to mention their conversation about military medical opportunities to his commanding officer, and she wasn't sure how to respond to what sounded like a recruitment inquiry. I've been very happy working in civilian trauma medicine, she said carefully. Of course, Commander Hayes replied. But, if you ever want to explore opportunities to use your medical training in more challenging environments, we're always looking for experienced trauma professionals. The woman in uniform stepped forward and extended her hand.
I'm Lieutenant Colonel Jennifer Rodriguez, Medical Corps. I understand you're interested in advancing your medical education.
Sarah realized that Rodriguez was probably the team leader who had provided David's excellent field treatment. The fact that she was both a military officer and a physician explained the sophisticated medical care that David had received before arriving at the hospital. I've considered nurse practitioner training, Sarah replied honestly, but there are financial and practical obstacles. The military has excellent programs for medical education advancement, Lieutenant Colonel Rodriguez said. Full tuition support, continuing salary during training, and guaranteed positions in military medical facilities after completion. Sarah had never seriously considered military service as a pathway to career advancement, but the financial benefits that Lieutenant Colonel Rodriguez was describing would solve the practical obstacles that had been preventing her from pursuing additional education.
What kind of training opportunities are available? She asked.
For someone with your background and demonstrated clinical judgment, we could support nurse practitioner training, physician assistant programs, or even medical school if that's your long-term goal.
The offer was more comprehensive than anything Sarah had imagined possible. Full financial support for medical education, combined with guaranteed employment after completion, would allow her to advance her career while continuing to support her sister's education.
I'd need to think about it, Sarah said, feeling overwhelmed by the sudden opportunity. Of course, Commander Hayes replied.
Here's my card.
When you're ready to explore the possibilities, give me a call. As the military officers prepared to leave, David looked at Sarah with a serious expression. You have real talent for emergency medicine, he said quietly.
Don't let financial obstacles or hospital politics prevent you from reaching your full potential.
Sarah spent the rest of her shift thinking about the conversation with Commander Hayes and Lieutenant Colonel Rodriguez. The possibility of military-funded medical education had never occurred to her, but it seemed like it could provide a solution to the financial obstacles that had been holding back her career advancement. More than that, David's comments about hospital hierarchy and the importance of recognizing clinical competence regardless of organizational position had made her more aware of the limitations of her current working environment. Dr. Weber's dismissive attitude toward nursing input wasn't just personally frustrating, it was potentially affecting patient care quality. When her shift ended, Sarah stopped by David's room to check on his condition before leaving for the day. He was sitting up in bed, reading another medical journal, and he looked remarkably good for someone who had undergone surgery just hours earlier.
How are you feeling? She asked. Excellent.
The pain is manageable, and I can tell that the surgical repair was successful.
Dr. Harrison did outstanding work. Are you still planning to encourage me to consider military medical training? Sarah asked with a slight smile.
David looked up from his reading with a serious expression.
Only if it's what you want to do. But I've seen enough medical professionals in enough different settings to recognize exceptional talent when I encounter it.
You have the instincts and judgment to excel in advanced medical practice. The financial support would certainly solve the practical problems I've been facing.
That's true, but there are other benefits too.
Military medicine gives you experience with trauma cases and emergency procedures that you'd never see in civilian practice. The training is intensive, and the standards are extremely high. Sarah realized that David was describing exactly the kind of medical career that had originally attracted her to trauma nursing: challenging cases, opportunities to make a real difference, and professional recognition based on competence rather than politics.
Can I ask you something personal? She said.
Of course.
Do you ever regret choosing military service over civilian medicine? David thought for a moment before answering. Never.
The training opportunities, the quality of the people I work with, and the sense of purpose that comes from the mission, it's exactly what I hoped it would be when I first enlisted. Sarah nodded, understanding that David's enthusiasm for military medicine was based on years of actual experience rather than recruitment rhetoric.
Think about it, David said.
But don't let fear or uncertainty keep you from pursuing opportunities that could change your entire career trajectory. As Sarah left the hospital that evening, she found herself genuinely excited about possibilities that she had never seriously considered before. For the first time in years, advancement in her medical career seemed not just possible, but practical and achievable. The chance encounter with David Chen was revealing opportunities that could transform her professional life, and she realized that she was ready to seriously explore them. Sarah returned to work the following morning with a sense of anticipation she hadn't felt in months. David's surgery had been successful, and she was eager to see how his recovery was progressing. More importantly, she had spent much of the previous evening researching military medical programs online, and the opportunities were even more comprehensive than Lieutenant Colonel Rodriguez had indicated. David was scheduled for discharge later that day, assuming his post-operative recovery continued to go smoothly. Sarah found him in excellent spirits when she checked on him during morning rounds. His surgical sites were healing well, his vital signs were completely normal, and he was already demonstrating the kind of rapid recovery that came from excellent physical conditioning and optimal surgical care.
"How did you sleep?" Sarah asked as she reviewed his overnight chart.
"Better than I have in weeks," David replied. "It's amazing what successful surgery and competent nursing care can do for your peace of mind." Sarah smiled at the compliment but focused on her professional assessment. David's recovery was proceeding exactly as Dr. Harrison had predicted, with no signs of complications or setbacks. His pain was well controlled, and he was already demonstrating the mobility and alertness that indicated his body was healing rapidly.
"I did some research last night," Sarah said as she checked his foresight.
"The military medical programs you and Commander Hayes mentioned are really impressive." David looked pleased by her interest.
"Did you find anything that seemed particularly relevant to your goals?" "The nurse practitioner program through the Army Medical Corps.
Full tuition support, continuing salary during training, and guaranteed assignment to a military medical facility after graduation."
"That's an excellent program," David confirmed.
"I've worked with several nurse practitioners who came through that training, and the clinical preparation is outstanding."
Sarah had been surprised by how comprehensive the military's medical education benefits were.
Not only would the program solve her financial concerns, but the clinical training appeared to be more intensive and practical than most civilian programs.
The guarantee of employment after graduation would provide the kind of job security that was increasingly rare in healthcare.
"There's just one concern I have," Sarah admitted.
"What's that?"
"I don't know anything about military culture. I'm worried that I might not fit in with the organizational structure and expectations."
David considered her concern carefully before answering.
Military medicine is different from civilian medicine in some ways, but the core values are the same: competence, dedication to patient care, and professional integrity.
If you have those qualities, the rest can be learned. What about the hierarchy issues I've been dealing with here? Are they better or worse in military settings?
Different, David replied. Military hierarchy is more formal and clearly defined, but it's also more merit-based.
When someone has demonstrated competence, their input is valued regardless of their rank or position.
Sarah thought about her interactions with Dr. Weber and the way her clinical judgment had been dismissed in favor of rigid adherence to organizational authority. The idea of working in an environment where competence was recognized and rewarded was genuinely appealing. "Commander Hayes gave me her contact information," Sarah said. "I'm thinking about calling her to explore the possibilities."
"I think that's a good idea," David replied.
"But I also think you should know something about Commander Hayes that might influence your decision." Sarah looked up from updating David's chart with interest.
"Commander Hayes isn't just a military officer," David continued.
"She's one of the most respected leaders in special operations medicine. The unit she commands handles some of the most challenging medical missions in the military."
"What kind of missions?"
"Medical support for special operations teams in remote locations, disaster relief in areas where traditional medical infrastructure has been destroyed, and training foreign military medical personnel in conflict zones." Sarah realized that Commander Hayes's offer of military medical training might lead to opportunities that were far more challenging and rewarding than she had initially understood. The prospect of using her medical skills in situations where they could make a critical difference was exactly the kind of career opportunity she had been hoping for. "There's something else you should know," David added, his voice taking on a more serious tone.
"What's that?"
David glanced around the room to ensure they weren't being overheard, then looked back at Sarah with an expression she hadn't seen before.
"My background is a little more complex than Commander Hayes initially indicated."
Sarah felt a slight increase in her heart rate. David's tone suggested that he was about to share information that was significant and possibly sensitive.
"In what way?" she asked.
"I'm not just a combat medic with special operations training," David said quietly.
"I'm a physician.
I completed medical school and surgical residency before joining special operations." Sarah stared at him in surprise.
"You're a doctor?" "Emergency medicine and trauma surgery," David confirmed.
"I joined special operations because I wanted to use my medical training in situations where it could save lives that might otherwise be lost."
Sarah felt a mix of shock and confusion. "Why didn't you tell the medical team here that you're a physician?"
David smiled slightly. "Because I wanted to see how the hospital staff would treat a patient they perceived as just a soldier. The quality of medical care shouldn't depend on the patient's background or status." Sarah realized that David had been conducting an informal assessment of the hospital's medical team throughout his entire stay. His questions about treatment decisions, his observations about clinical competence, and his comments about hospital hierarchy had all been based on his perspective as a fellow medical professional.
"So when Dr.
Weber was explaining to the medical students about not trusting nursing input,"
Sarah began.
"I was watching a physician demonstrate exactly the kind of professional arrogance that leads to poor patient outcomes," David finished. "And I was watching a nurse with excellent clinical judgment being dismissed because of organizational politics rather than medical competence." Sarah felt a flush of embarrassment as she realized that her entire interaction with David had been observed and evaluated by someone with the medical expertise to assess her professional performance. At the same time, she felt a sense of validation that her clinical decisions had been approved by a physician with David's background and experience.
"Were you testing me?" she asked.
"Not testing," David replied.
"Observing.
I was curious to see whether your clinical instincts were as good as they appeared to be during my initial assessment."
"And what did you conclude?"
David looked at her with a serious expression. "I concluded that you have the clinical judgment, technical skills, and professional integrity to excel in advanced medical practice.
More than that, I concluded that you're being wasted in an environment that doesn't recognize or utilize your abilities." Sarah felt a mix of professional pride and personal uncertainty.
Having her clinical abilities endorsed by a physician with David's background was gratifying, but it also increased the pressure she felt about making decisions about her career advancement.
The military medical opportunities that Commander Hayes offered, Sarah said, were those based on your recommendation?
Partly, David admitted. But Commander Hayes makes her own assessment of potential candidates. She wouldn't have made the offer if she didn't think you had the potential to succeed in military medicine. Sarah realized that her brief interaction with David had somehow led to a career opportunity that could transform her professional life. The financial support for advanced education, combined with the promise of challenging and meaningful work, represented exactly the kind of opportunity she had been hoping for without really believing it was possible.
"Can I ask you something?" Sarah said.
"Of course.
Yesterday, when Dr. Weber was dismissing my clinical input, why did you speak up?"
"You could have just let the hospital hierarchy work the way it normally does." David was quiet for a moment, as if considering how to answer. "Because good medical decisions depend on listening to all the qualified voices on the team, regardless of their organizational position. When I saw a nurse with excellent clinical judgment being dismissed because of professional arrogance, I felt obligated to intervene. But you could have just identified yourself as a physician and resolved the authority issue immediately. That would have solved the immediate problem, but it wouldn't have addressed the underlying issue," David replied. "Dr. Weber's dismissal of your input wasn't really about my case specifically. It was about his attitude toward nursing professionals in general."
"Pulling rank wouldn't have changed that attitude."
Sarah realized that David's approach had been designed not just to ensure optimal care for his own case, but to highlight broader issues about professional respect and collaborative decision-making in medical settings. "Besides," David continued, "I wanted to see if the hospital's leadership would recognize and support clinical competence when it was demonstrated. Dr. Martinez's willingness to listen to your assessment and adjust the treatment plan accordingly was encouraging." Sarah thought about Dr. Martinez's support during the initial trauma assessment and her later comments about the importance of input from all team members. It was clear that not all physicians shared Dr. Weber's rigid adherence to hierarchical authority.
"What happens now?" Sarah asked.
"With your recovery, I mean. I'll be discharged this afternoon and return to duty in about 2 weeks," David replied. "The surgery was successful, and my recovery is proceeding ahead of schedule."
"And what happens with the opportunity Commander Hayes offered me?"
David smiled.
"That's entirely up to you.
But I hope you'll seriously consider it. Military medicine needs people with your clinical skills and professional integrity." Sarah realized that she had already made her decision, though she hadn't consciously acknowledged it until that moment. The combination of financial support for education, professional opportunities for advancement, and the chance to work in an environment that valued clinical competence over organizational politics was exactly what she needed to move her career forward. "I think I'm going to call Commander Hayes this afternoon," she said. David looked pleased by her decision.
"I think that's excellent.
Just remember that the training will be challenging, but the opportunities afterward will be worth the effort." As Sarah prepared to complete David's discharge paperwork, she reflected on how dramatically her perspective had changed in just 2 days. A routine trauma case had become an encounter with someone whose background and insights had shown her possibilities she had never seriously considered.
Dr. Weber appeared at the nurse's station as Sarah was finalizing David's discharge documentation.
He looked pleased with himself as he reviewed the surgical outcome and recovery timeline. "Excellent case," Dr. Weber announced to the medical students who were accompanying him on rounds. "This demonstrates the importance of decisive surgical intervention in trauma situations." Sarah looked up from the paperwork with interest, wondering how Dr. Weber would characterize the events of the previous 2 days. The patient presented with multiple gunshot wounds and significant blood loss, Dr. Weber continued. Immediate assessment indicated the need for emergency surgical intervention to prevent life-threatening complications. Sarah noticed that Dr. Weber's account omitted several important details, including the initial push for immediate surgery that had been modified after more thorough assessment, and Dr. Harrison's role as the primary surgeon. "The key lesson here," Dr. Weber said, "is that trauma surgery requires decisive action based on medical expertise and training. When lives are at stake, there's no time for extended consultation or second guessing. Sarah found it interesting that Dr. Weber's post-case analysis focused on the importance of surgical authority rather than the collaborative decision-making that had actually led to optimal patient outcomes.
David appeared in the hallway as Dr. Weber was concluding his impromptu lecture.
He was dressed in civilian clothes and, carrying a small bag, clearly ready for discharge. Sarah noticed that he moved with only slight stiffness from his surgical sites, demonstrating the kind of rapid recovery that came from excellent physical condition and optimal medical care. "Dr. Weber," David said, approaching the group with a friendly smile. "I wanted to thank you for your involvement in my case." Dr. Weber looked pleased by the acknowledgement.
"You're very welcome. I'm glad we were able to provide excellent surgical care." The surgical outcome was indeed excellent, David agreed.
Dr. Harrison's technical skills were outstanding, and the postoperative care has been exemplary. Sarah noticed that David was diplomatically crediting Dr. Harrison with the surgical success while acknowledging Dr. Weber's supervisory role. "I also wanted to commend the nursing staff," David continued.
"Sarah's clinical assessment during my initial trauma evaluation was particularly impressive."
Dr. Weber's expression shifted slightly. "Nursing support is certainly important in trauma cases."
"Absolutely," David replied.
"In my experience, the best medical outcomes happen when all team members feel comfortable contributing their clinical observations and expertise." Sarah watched Dr. Weber process David's comment, apparently unsure how to respond to what sounded like mild criticism of hierarchical medical decision-making. "Well," Dr. Weber said finally, "I'm glad your recovery has gone smoothly." David shook Dr. Weber's hand politely and, then, moved towards Sarah to complete his discharge process. She handed him his discharge instructions and follow-up appointment information, along with prescriptions for pain management and wound care. "Thank you for everything," David said, his voice sincere. "You provided exactly the kind of professional nursing care that makes all the difference in patient outcomes." "It was my pleasure," Sarah replied honestly. "I hope your recovery continues to go well." David smiled and handed her a business card. "This has my contact information, in case you have questions about military medical opportunities or if you just want to stay in touch professionally." Sarah looked at the card and was surprised to see that it identified David as Dr. David Chen, MD, Emergency Medicine, U.S. Army Special Operations Medical Unit. His military rank was listed as Major. "You really are a physician," she said softly. "I really am," David confirmed. "And you really do have the clinical skills and professional judgment to excel in advanced medical practice." As David prepared to leave, Commander Hayes appeared in the hallway with Lieutenant Colonel Rodriguez. Both women looked pleased to see that David's recovery was complete and that he was ready for discharge. "Ready to get back to work?" Commander Hayes asked. "More than ready," David replied. "This has been an excellent reminder of why military medicine attracts the finest medical professionals." Commander Hayes looked at Sarah with interest. "Have you had a chance to think about our conversation yesterday?" "I have," Sarah replied. "I'd like to explore the opportunities you mentioned." "Excellent," Commander Hayes said, looking genuinely pleased. "Why don't you call my office next week, and we'll set up a time to discuss the specifics." As the military team prepared to leave, David looked back at Sarah one final time. "Remember," he said, "talent like yours shouldn't be limited by financial obstacles or organizational politics. You have the potential to make a significant difference in emergency medicine." Sarah watched them leave, feeling a mixture of excitement and nervous anticipation about the changes that were about to happen in her professional life. In just 2 days, a routine trauma case had become a career-changing encounter that was opening doors she had never imagined possible. Dr. Martinez appeared at Sarah's shoulder as the military team disappeared down the corridor. "Interesting case?" Dr. Martinez asked. "More interesting than I initially realized," Sarah replied honestly. "David Chen made quite an impression on the staff," Dr. Martinez continued. "His comments about collaborative medical decision-making were particularly thought-provoking." Sarah realized that David's informal assessment of the hospital's medical culture had been noticed by more people than she had initially understood.
He seems to have extensive medical background, Sarah said carefully.
Dr. Martinez smiled slightly.
More extensive than he initially let on, I suspect. But that's not uncommon with military medical personnel. They're often reluctant to discuss their qualifications unless it's directly relevant to patient care.
Sarah spent the rest of her shift thinking about the opportunities that Commander Hayes had offered and the encouragement that David had provided. For the first time in years, advancement in her medical career seemed not just possible but inevitable. That evening, Sarah called her sister at college to share the news about potential military funding for advanced medical education.
That's amazing, her sister said, clearly excited by the possibilities.
Military medical training is supposed to be some of the best in the world. It would mean that I could pursue nurse practitioner certification without worrying about tuition or reducing my income during training.
More than that, her sister replied, it sounds like it would give you opportunities to use your medical skills in ways that really matter.
Sarah realized that her sister understood exactly why the military medical opportunity was so appealing. It wasn't just about financial support for education, it was about finding a professional environment that would recognize and utilize her clinical abilities to their fullest extent.
The following Monday, Sarah called Commander Hayes' office and scheduled an appointment to discuss military medical opportunities.
As she hung up the phone, she felt a sense of excitement and possibility that she hadn't experienced in years. Dr. David Chen's 2-day stay at St. Mary's General Hospital had revealed opportunities that would transform her career and her life. More importantly, it had shown her that her clinical judgment and professional abilities were valued and respected by medical professionals whose opinions she could trust. Sarah looked around the trauma unit where she had worked for 6 years, realizing that while she had gained valuable experience there, her future lay in a different direction. Military medicine would provide the training, opportunities, and professional recognition that would allow her to reach her full potential as a healthcare professional.
The nurse who Dr.
Weber had dismissed as lacking the training to make critical medical decisions was about to embark on advanced medical education that would qualify her to practice at the highest levels of emergency medicine. And it had all started with a wounded SEAL who recognized talent when he saw it, regardless of organizational hierarchy or professional credentials.
Sarah smiled as she thought about David's final comment about not letting talent be limited by obstacles or politics.
She was ready to prove that he had been right about her potential, and she was grateful that their paths had crossed at exactly the moment when she needed to hear his message.